Congressman Neil Abercrombie held a public forum on healthcare reform in Honolulu on July 1st. It was his second forum of the summer that gathered public input that he has taken back to Washington as Congress works on legislation to reform the nation's healthcare system. The forum included a panel representing different community organizations. Here are excerpts of the Congressman's opening remarks to the forum.
Yes, we should all be enthusiastic tonight because, at long last, probably not since Harry Truman first put the idea forward, we are on the verge of having national health care, and this forum tonight is going to be one of the principal elements in seeing to it that it actually takes place. And so I'm very pleased you're here, and you should be pleased as well for yourself. We face a health care crisis. There's no question of that. That you're here tonight is proof that you're well aware of that. There was a question of the insured and the uninsured. So those with the health insurance, they are not so secure anymore. I'm sure that Randy and others will be able to talk, and Jim can talk from the business side, just in referring to the prepaid health care plan, which was way ahead of its time in the mid-1970s, and is actually forming the basis in many instances, in great measure, I should say, for the public option. You could actually refer to the Hawaii prepaid health care bill as almost a great-grandfather or grandmother of what the public option is beginning to look like. So even those with health care insurance right now are worried about it. Right here in Hawaii, because of the rise in premiums that are necessary and the costs associated with it, Randy can probably correct me if I'm off on this, but I think it's going to be 29 or 30% rise, something in that range, just to take care of the premium necessities of the insurance we already have and previously felt secure about. Bankruptcy now has entered into the picture. Now that's something that really hasn't come to the forefront. One of the reasons we're going to have to, and I'm going to give you a statistic now you may not be aware of. 2 out of 3 bankruptcies in 2007 were due to medical bills, not to foreclosures, on the house or the failure of a small business. And many of them, as high as 3 out of every 4 of those, already had health insurance. They had health insurance, but the health insurance didn't cover everything that it needed to cover. Small businesses can't afford premiums for their workers, and they may hire only part-time workers to avoid the Prepaid Health Care Act. That's one of the things that's coming out in a recent report. Big business can't compete globally. Believe me, I'm dealing with it every day. People from Michigan coming in, from Ohio, absolutely devastated, because if every other nation producing cars, every other region producing cars has health care insurance, it means automatically, no matter what we do, how we produce it, what kind of corporate structure we have, we are not going to be able to compete if it's $700, $750, $1,000, $1,200, and $1,500 per vehicle, which has to be added into it because we don't have national health care in this country, and every other competing entity, from India on, has health care insurance. Now, I'm in my sermon mode right now, as you can see. If you lose your job and you lose your health care insurance, obviously it's not portable. That's one of the things that we're going to deal with in the public option, is it's going to be portable. And we all pay. Anybody who's dealing with health care insurance right now, we understand that. State and federal government pay 75% of the uncompensated care, while those who are insured pay higher premiums. In Hawaii, right now today, when people say, well, the people are uninsured, okay, that's too bad, that's tough. All of us who have insurance are paying $700 a year more in order to take care of those who don't have the coverage right now, because the cost gets shifted. It doesn't disappear. It does not disappear. Somebody has to pay. By 2018, the national spending in health care will double. Will double. In roughly 9 years, it's going to double, up to probably between $4 and $5 trillion. By 2016, premiums are estimated to take 8% of your income. I think that's low. I think that's going to be a low figure. That must be fully paid for. Well, what constitutes fully paid for has differing definitions. And you know, if you're going to continue to have an insurance system that puts profits for the insurance companies that have health care for the people, well, yes, fully paid for means something entirely different than it does to me. I don't want to fully pay for the profits of insurance companies at the expense of people's health care. So, you know, we're going to have to argue about what fully paid for means. We're not supposed to increase the deficit. Then we got to address cost and quality and access. All of those issues come into it. Now, the argument here is if you have a plan and you like it, you can keep it. But let me tell you something. You may think you've got a plan, but what if the plan alters? And if you're dealing with prescription with the donut hole in it, and you're over 65, the plan you think you like may change tomorrow morning, and all of a sudden you don't like it anymore, or it alters significantly, or the cost goes up so much you don't like the plan anymore. If you don't have insurance, you're going to be covered, and if you lose your job, it doesn't mean you're going to lose it. That leads us to the public plan. And this is to promote competition. I find the irony in this just delicious. Really, honestly. Oh, the public plan, I've had this said to my face. Well, if we have the public plan that you're talking about, we can't compete with you. And I said, well, all right, and what does that tell you about your plan then, if you can't compete with it? And I'm not trying to pop HMSA or Kaiser on this because they're dealing with, they're swimming in the water that they're in. The idea here, believe it or not, is to lower costs. And I'll tell you why I think the public option will actually lower costs. Because we're going to get into investing in prevention and wellness and make it more than just a word. And just a word. We're going to have to do this. If we're going to have a public option, if we're going to change the healthcare system around, people are going to have to understand that we have to change the way we live. And that people are going to have to be rewarded for those who are doing the right thing.